So now I get the really an incredible honor to introduce Joanne. She's a personal friend of mine now, just from working in this arena. Joanne has been a natural health practitioner since 1997. In her early 30s, she experienced unresolved health issues that led her to investigating more holistic options. It sounds familiar for a few of us. That's where she found answers to resolve chronic digestive and energy issues. She's got a few specialties, as a lot of our people do. So she does eye and hair analysis. She's also a level two Reiki practitioner. Incorporating energetics and spiritual components of healing are a core part of healing. She is passionate about educating everyone who wants to learn about taking charge of their health, minimizing dis-ease and illness, and maintaining a high quality of health as they age. She's taught with the Institute of Holistic Nutrition in Vancouver and with CanFit Pro based in Toronto. Her work with women transitioning through menopause, I don't know if I can relate to that, maybe a little, has become a key part of her work as well as working with CanConnect. So now I'm going to pass it on over to Joanne, and she's going to educate us on strategies that we can use to detox from the things that may very well be plaguing all of our systems on a daily basis.
There we go. So, Candida and parasites, two very big topics, could absolutely be full courses on their own. And as a matter of fact, any parasitology course that you would do in college or university can be multiple courses. So this is a very, kind of succinct overview of both to kind of show you, because there's a little bit of crossover between the two of them, to show you how they can be underlying a lot of different things that maybe get missed in typical diagnoses from the allopathic community, and how you can identify them, how you can mitigate them, and obviously how to work with them. So I just want to make sure we've got a disclaimer here that says all this information is for the purposes of education, and always consult your qualified primary health care practitioner, whoever that is, before acting on any information. There's a lot out there. We're inundated on a daily basis by social media feeds, and there is no quick fix. One of the things that we really value within the scope of practice that we have within CanConnect is that everyone is an individual. Biochemical individuality is a key part of working with an individual and being able to truly assess them in a holistic fashion that attends to the person as an individual, because as we know, it's physical, mental, emotional, spiritual. There's a whole dynamic that goes into wellness. And so what works for one person is not necessarily going to work for someone else. There is no cookie cutter approach. So a little bit of background, which we probably don't really need to really elaborate on, but obviously over the last 100 years or so, industrialization. I just finished reading a fantastic book. It's A Secret History on the War on Cancer, and that dates back over 100 years of scientific material that's basically been buried, and that all deals with, toxins in our environment. So obviously we know that those are increasing on a, almost exponential level. We know that the nutrient value in our food is decreasing. And even with, more focused biodynamic organic food practices, it's still a challenge because of what's in the atmosphere to have the highest quality food that we need to have. And also an increase in exposure to radiation, solar flares, geomagnetic, EMFs. We have, especially over the last 5 years, an increase in stress and anxiety and social disconnection. These are all part of, our mental, our social well-being, our emotional well-being. And so the necessity to support excellent immune health and this need for ongoing detoxification. I mean, it was one of the first things I learned when I started studying, is to regularly detoxify the body, keep it healthy in the long term, but also to detoxify. And that does include, paying attention and looking out for these organisms of parasites and candida. So personally and professionally, I kind of have the approach that it is not black or white. We have a lot of, even in the holistic world, dichotomy of the terrain theory versus, pathogen theory, and that there's no absolutes. It's really both. And the terrain creates the environment for the organism, in most cases, to be a pathogen. Now, this isn't necessarily true in severe or acute cases when the body has had some kind of very dramatic or acute exposure to something. Obviously then the body is overwhelmed, and that would be a bit of a different circumstance. But it's that balance between both. It's keeping your body healthy so that it is resistant to disease. It's keeping the terrain alkaline and all these things that I'm going to go into to really maintain good health so that these disease states don't have an opportunity to take hold. So we know that toxins are also stored in fat tissue and as well as cells. So these things get in there, and the body has an amazing capacity to adapt and come up with protective mechanisms. So how do we get at those toxins once they're in there? We have to do detoxification programs to make sure that they get out. And because of these factors, our bodies become overloaded and overwhelmed much more easily than they ever did. So it really is to be a vigilant process and an ongoing process to be on top of things on a consistent basis. I was kind of go by the 80-20 rule. And you can break that down daily, monthly, weekly, but 80% of the time you're doing things that are actively improving or looking after your health. And that 20% can be sort of cordoned off as the fun or the treat stuff. And if you're having issues or being challenged by dis-ease conditions now, then obviously you'd have to up that to maybe 90 or 100%. And so we just want to really support our bodies to do what they're naturally designed to do. So I'll just give a little quick summary of what I'm going to be touching on. What are these organisms? How are we exposed to them? Some of the signs and symptoms of infection, which are really important because I'm going to touch on what early signs are. And it's really important to get on top of that when you see some of these things. Just don't assume that, oh, what is this weird thing that's happening? How they become problematic in the body. Of course, what I just mentioned, supporting natural detoxification pathways, and foods, herbs, enzymes, homeopathics that we can use as treatments. And then gut and immune health in the role of prevention, and some lifestyle considerations as well, and how we would maybe avoid reinfection, which can be very key in certain circumstances. So I want to just also preface it by saying, don't freak out, because as the person who put this presentation together, and I've done this many times in various forums, but doing a review and kind of assimilating all my knowledge and reviewing everything, and I'm even going, oh, I think I need a parasite cleanse. I'm rereading symptoms and things, and so the main thing is to obviously education and awareness is a key factor. But normally we're exposed to these things, and if our body's in good shape, our body knows what to do about it. So obviously this presentation is to promote the awareness so that you can take the proper actions. So let's take a look at what these organisms actually are. For a parasite, it's an organism that derives its nutrition and shelter in or on another organism, which is typically called or seen as the host. And some of these parasites are specific to a particular host, and some are not. And many parasites have two hosts. One usually acts as a vector for transmission, so like an animal to human type of circumstance. So there's key categories of these organisms. We've got, and different parasitology, they actually can categorize them a little bit different, but for our purposes, we have spirochetes, which actually are a type of bacteria. We have protozoa, and they are single-celled organisms that can multiply or divide within the host. And these are kind of the nasty ones with more the acute type of infections that you would see. Then we have different types of worms under the helminth category. And then we have something called ectoparasites. And we can obviously relate to these when we've known about bed bugs and lice and ticks and scabies, demotic, screwworm. These are things, I've had personal experience with my family with scabies when my kids were little. Pinworm, that's pretty common in roundworms for childhood infections. I'm sure lots of parents have had experience with that. So, these are things that we've all probably seen. And obviously, when you see these magnified pictures, they look really nasty. These are microscopic in most cases, but they can get quite large. What is Candida albicans? Well, Candida is the Latin. Candida albicans is the Latin name of the form. So in this category, there of fungus, there's actually 144,000 known species, of which yeast and molds are under this kingdom of fungi. Mushrooms are also fungi. And my husband's name is Guy, and he's a pretty fun guy as well. So anyway, Candida is a yeast form of fungus. It's naturally occurring in the body. So this is really important to know and remember. It's unicellular and oval shaped, and it's one of about 81 different species, and it is kind of the most common one. It's found in small amounts in the mucosa of the mouth, the throat, the intestines, the vagina, and the urogenital tract. So it's really important to remember that we are actually already have that. So how are we exposed to parasites? Well, there's lots of different exposure routes, surfaces. So soil, contaminated soil, water, fruits and vegetables, if they have it on the surface, which is why you're usually recommended to wash your fruits and vegetables and not just in water, to do it in some type of, fruit and veggie wash or hydrogen peroxide or something like that. Contaminated feces that have eggs in them, raw and undercooked meat is a pretty common source, and insect bites. So mosquitoes, as I said, ticks, things like that. So the eggs can burrow into the skin and they can be ingested by the mouth. And also you can breathe some of them in if they're super microscopic. The eggs can mature in some cases in the intestines, and in other cases they migrate via the circulatory system to other organs. So here's just to give you a few life cycles of different types of parasites. The intestinal hookworm typically comes in through the larva and penetrates the skin. The life cycle of a tapeworm would have a vector or an intermediary host, such as a pork, the pig or cows. And Ascaris is one that's the eggs are in soil. And this one is interesting because you actually you ingest it and then you often cough up the eggs and then you re-swallow and then they go into the intestines. And then they have their whole life cycle development. And of course, when we get into talking about treatment strategies, it's really important that we're talking about, getting all these different phases of the life cycle. And Candida, as I said, is endogenous. So we're not technically exposed to it. It is, as I said, a naturally occurring yeast, and it has, in the yeast form, a very symbiotic role in the body. It actually has an important function in the body in its symbiotic form. It aids in digestion and nutrient absorption. It actually binds metals in the mouth and the gut. And there's an interesting fact that it can actually accumulate mercury up to 150 times its weight. So it is essentially protecting the body. So we had originally talked about this talk adding in metal toxicity, but that's really a whole talk all on its own. So keep posted, and we'll be doing that one eventually as well. So high mercury levels actually are directly proportional to Candida overgrowth. So that's a very important thing to keep in mind. And it aids in decomposition of the body in death. It's actually part of the cleanup crew after we die. And it has, we just think of, you put your dead body in a box and it could be a metal box, but you go in a year later and it's decomposed. Well, where is the decomposition started from? It started from within. So that tells you right there that we have internal mechanisms that when we have necrotic or dying tissue, that we put a cleanup crew there ready to step in. And it magnifies on an emotional level the need to strengthen personal power. And that also has a component in parasitology as well, something to do with actually, you could literally have something bugging you. Maybe it's something that you've kept inside to yourself that you should be sharing, something that's really bothering you that you really need to be talking about and getting it out there. And also around personal boundaries is an interesting one for parasites. So 90% of us are born with normal budding candida in the non-pathogenic and symbiotic form right from birth. And this is a normal thing. So what happens then? Well, we have a morphing of candida to the pathogenic form. And that happens with parasites as well, because survival of the organism is through their progeny, right? So they want to make sure, just like humans do, that we survive and that we proliferate. So it will move from a symbiotic to a pathogenic form or mycelia form when the body is exposed to some key things. And I think some of you might know what some of these are, which is antibiotics, chlorinated water, oral contraceptives, and steroid use. Again, exposure to mercury, because that will propagate growth actually as a protective kind of thing, because a lot of mercury can be stored in the biofilm of the Candida organism. And lifestyle. So poor diet, alcohol intake, or high levels of alcohol intake, high stress. These are all things that will change the terrain, make the terrain more acidic, and in that case, more hostile to the organism. So they have to morph and change in order to survive. So inflammation, not enough beneficial gut bacteria, which of course we know chlorinated water and antibiotics in particular they don't just kill the good bacteria, they kill the beneficial bacteria as well. And I'm just mentioning mold here because when you think candida, you often think molds. Molds are a different type of fungus, but they can be connected to candida overgrowth simply because when you've been exposed to molds in your shower, by a damp window, that white stuff, or the black mold, which is very nasty. You never want to have mold in your environment. I'm like a mold freak, and I have a very sensitive nose because I have had my own personal issues with candida overgrowth. And, I can walk into a room and go, oh, there's mold in here. And I'm like that canary in the coal mine. So you become sensitized to it. And mold can obviously lead into the other because your whole body becomes more sensitive, your immune system becomes more sensitive, and you can become more sensitive to a fungus overall. Again, sick building syndrome, that's a common place of black mold, and that can be a very dangerous, very not great setup. So, the vicious cycle that I've pointed out here in this slide, you get some kind of infection, you get antibiotics, you wipe out the friendly bacteria, candida has a chance to proliferate, then you may be exposed to toxins, and then it weakens the immune system, and it just keeps the cycle going. So we want to make sure that we can break that cycle. So the life cycle then of the organism, which I mentioned, is it moves into this pleomorphic stage, which is to become this myceliated form, which is much more, pathogenic. It's much more disease causing. It causes all kinds of different symptoms. This is what happens here. So you can see we have just the yeast form here, and then the initiation. This would be like on the early type of infection stages. I'll show that in the next few slides. And then you get maturation, but then you get dispersal and propagation through this extended form. And also something that shows up in this more advanced pathogenic form is this what's called biofilm. and we'll talk about that in a minute. So signs and symptoms. So signs and symptoms of a parasitic infection. And there's crossovers with Candida as well. So digestively, there's bloating, gas, indigestion, diarrhea, abdominal pain, all the digestive upset stuff. Teeth grinding at night is a very common one, especially with children. But if you catch a little bit of teeth grinding going on, check for pinworm with your kids. That's the first thing to check for. On the metabolic side, you can have weight loss, weak, feel fatigued, unexplained anemia and malnourishment, because that's usually a hookworm that's, basically feasting off of you. You can have itchy nose and anus or vagina. Again, that's very common with uh, pinworm. Skin tracks or patches or rash on the skin or the feet. As I mentioned, some entry points are through the bottom of the feet. So checking for that, making sure that, there's no crusty overview, or even if skin is peeling or things like that might be a sign. Musculoskeletal joint and muscle pains, inflammation there. And then mental, emotional, you can have irritability, again, especially in children. You just don't understand why they're reacting. Of course, adults can be like that too. Mentally, maybe just a little bit slow, still the brain fog. And in more advanced cases, you can actually have convulsions and seizures. In Candida, as I said, when it hits this myceliated form, and you will see, mild symptoms start up in the early form as well. And this is what gets really important, is to pay attention and recognize these early forms of infection so that you can get on top of it. Cravings for sugar, you become sensitive to alcohol and fruit. Again, the same type of things with the digestive system: gas, bloating, diarrhea, constipation, nail fungus and skin rashes, yeast infections, jock itch, toenail fungus, as I said, itchy ears, allergies, brain fog, and then more issues with depression, anxiety, autonomic nervous system dysregulation. So it can get very extensive, and that's how they can become very problematic. So in sort of the idea of Candida as well, an early parasitic infection, interestingly enough, can be somewhat symbiotic or commensal. Infections can be asymptomatic for a long time because you can have an exposure, you can have the parasite sort of come in and have this mutual adaptation between the host. The parasite's able to live and reproduce without a lot of symptoms. And maybe that's because the person's body is actually very strong and their immune system is very strong at that point. And the host offers resistance or requires immunity, some type of immunity. It can produce antibodies that can neutralize the parasite. It become immune because of previous infection, or it can just increase its powers of repairing and regenerating the injured tissue cells. Again, if the terrain is really strong, and ideally, like our immune systems are designed to deal with these invaders on a regular basis with phagocytosis, breaking it down, doing that Pac-Man type of scavenging through the body and dealing with these things as they come into the body. But, if the terrain becomes dysregulated and then it becomes hostile, two things will happen. Either the parasite gets killed or the host is destroyed. We've got to figure out one or the other. So this is where we need to look at what treatments that we're going to have. So when we have a further type of further advancement of the parasitic infection, then in an acute phase where the organism, the host, the person is exposed to something, as I mentioned, the protozoa or more the acute type of exposure, like with malaria infection, exposure can be fairly quick, and then it can build into something very, very quickly where it can be very deleterious to the host. Lots of organ failure or tissue failure can start to happen on a quick basis if the host is in a very compromised position. In a systemic infection, which can build much more slowly and is a little bit more insidious, it's because the host is slowly degrading over time. The person's immune system slowly gets eroded by the toxic waste that the parasites are creating. Obviously, they're proliferating. Some worms can produce up to 30,000 eggs in one day, which is an incredible number. Again, they want their population to survive. And also, parasites, some of them, like hookworm, actually thrive on us. They deplete us of our blood, our nutrients. And so, over time, as the population can grow in your system and they're doing more of their feeding, then we are suffering and we can have anemia and malnutrition. And also, it can be attacking our tissues and degrading our tissues to contribute to something like leaky gut, which allows proteins to pass through and trigger further immune responses. So it has a similar sort of cycle as Candida in that it can propagate further and further systemic infection as it goes along. And the host becomes more and more incapable of fighting the parasitic infection on its own. So there can be more deleterious type of complications from untreated parasitic infections like appendicitis, prolapse colon, edema of the rectum, cysts and tumors, syphilis, Yaw's disease, Lyme disease, relapsing fever can all be attributed to spirochetes, malaria, which is related to plasmodium, which is an amoeba, and ulcers in the intestine, liver, and brain, which is an enantamoeba. So these are pretty nasty and they need to be dealt with fast and probably pretty aggressively. In an early Candida infection, as I said, some of the symptoms can start out fairly mild, and you can often see the progression of these if they're not being looked after. So a mild skin rash, itchy ears, this craving for sugar that can continually increase. Then you have allergies. You can have bladder infections, urinary tract infections, vaginal yeast infections with discharge, coating on the tongue or thrush. And you can see some sort of mild forms of the nail fungus and the skin fungus in the slides here, or the skin rash. But as it becomes more systemic and not treated, you can see that these photos can look to get pretty nasty. Then the toe fungus can get to the point where you can literally lose a toe if it gets to that point, which you don't want to do. And some of these symptoms can mimic mercury toxicity because, of course, as I mentioned, the Candida can actually harbor and sort of bind to the mercury, and the mercury levels can go up fairly high, and therefore the Candida levels will go up fairly high. So underlying things like chronic fatigue syndrome, fibromyalgia, autoimmune diseases like Hashimoto's, rheumatoid arthritis, ulcerative colitis, multiple chemical sensitivity, psoriasis, lupus, MS, ADD, ADHD, anxiety and depressive disorders. These can all have an underlying component of candidal and fungal infections. So rather than going just to what that main thing is or that main diagnosis is without thinking about, well, what's the root cause? And in holistic medicine, that's a key component, is to get to the root cause. What's really going on to create this imbalance in the body, and what's really happening so that we can address the root cause. So how are these things diagnosed? Well, in sort of allopathic realms, we can use stool samples. We can do things like an endoscopy or a colonoscopy, blood tests, obviously, imaging tests that could check for lesions either in the brain or in different organs. In naturopathic and functional medicine, some of these do apply. I personally am trained in iridology and sclerology, so eye analysis. Wendy's trained in live and dried blood analysis. We can do those. I also do epigenetic hair mapping. That will show a lot of different things about what's going on with the body via the hair. Obviously, we can have access to different labs that will do stool samples. Obviously, one of my major tools has always been a nutritional symptomatology questionnaire. If you have a lot of those symptoms and you're presenting them, especially in a severe form, then we would automatically look to a possible candida or parasitic infection. That would make sense. Part of a food sensitivity test, which is like a food intolerance test, and it is an immune related test. There is a portion that will test for the blood antibody for Candida, so you can rule it out within that food sensitivity test. And this is an interesting one, which is the sputum test. And I've put a little diagram here. This is specific for Candida, actually. And you can do this, but just by spitting in a glass of water in a cup, and you can see if there's long, stringy legs and suspended specks and different parts to the sputum that can tell you that, you know, the stringy legs actually also almost mimic the mycelia that the Candida looks like in under the slide, under a microscopic slide. So lots of different ways. And, you know, depending on your practitioner and your provider who you would go to, obviously they can recommend different whatever tests that they're using in their clinic setting. And if you suspect, but they're not doing those tests, you can say, you know, I'd like to be checked for this. I'd like to be checked for a candida infestation or a parasitic infection. And I'd like to be able to rule that out. So when we want to start doing treatment or we want to approach getting the body back into a state of balance, we don't just jump on doing a bunch of herbs and taking a bunch of different things because number one, we've talked about, you know, the terrain is extremely important as to how the body gets to these states in the first place. So that's the first place to start, is to support the terrain. And one of the key ways of doing this is to support the detoxification pathways. So it is important to prepare the body for treatment. And obviously this is actually part of the treatment. It's not even preparing the body, it's actually part of the treatment, which is alkalizing the body and with minerals, with greens, with basic formulations, i.e. actually something that would be called basic tabs or basic powder, which has like a sodium and a potassium in it. So we want to improve stomach function. I'll detail that more again in some of the treatment part, but apple cider vinegar, bitters, eating bitter foods like arugula, mustard greens, dandelion greens, those types of things. Betaine HCl, hydrochloric acid, just to improve the stomach function overall. We want to open up the pathways. So you want to look after your liver. Again, very simple ways to do that through eating dandelion greens, drinking dandelion tea. Those are some basic ways that you can start doing that. The kidney and the bowels, you want to make sure that these are all open and functioning properly. Hydrating, obviously, that's a really key one because we are mostly water. We're like 70% water. And obviously, water as a solvent, it flushes and it helps excrete things. So making sure you're properly hydrated. And a lot of people don't even know what is a basic, you know, a baseline for proper hydration. And it's your body weight divided by 2 is the ounces of water that you should be consuming a day baseline. So if you are obviously outside, active, you know, taking a sauna, sweating, drinking coffee, those kinds of things, you need to increase your the amount of water that you're drinking. Eating chemical-free food. So look at starting to clean up your diet. And I should have added in there also even cleaning up your house, cleaning up your personal care products. Those are really important to make sure that you reduce your exposure to chemicals. And especially with candida and fungal infections, you want to lower your sugar intake. And this is extra sugars. These are like obvious sugars. These are simple carbohydrates. It used to be recommended that you just take out sugar altogether with the candida diet. you don't want to do that anymore. You actually want to nourish the body with good complex carbohydrates. So some of them are good and encouraged for you to consume, but it's all the simple sugars. So all the pastries, all the white flour products, all the sodas, all the extra added stuff that you want to be able to take out of your body. So now we'll get into some natural treatments and some options for foods, herbs, homeopathics, also some enzymes. So there are again some crossovers, common aspects of both types of organisms. And this comes actually from more of a biological medical perspective, which is we don't necessarily want to be that vigilant in killing off all the organisms because they do have, even parasites all have their, innate forms. As I mentioned at the beginning, we're exposed to parasites all the time. Our body should be naturally designed to deal with them. And a lot of times, it's just a good, sort of exposure and check on that with our immune system. So we just want to get them back to, manageable states, especially with the Candida, because it is endogenous to our mucosa. And obviously, it has benefits. So we don't want to kill that off completely. But the other thing that's really important with both of these organisms is that they create a biofilm. And that gets to be the tricky part because it encases or cloaks the organism from being found and being able to be, destroyed or put back down to a colony size that can be dealt with then by the immune system naturally. So I'm just going to talk a little bit about biofilm and what that is. So it's a protective layer created by these communities of microorganisms, and they're made up of a sticky matrix of polysaccharides, including calcium, magnesium, and iron. And there's a protein mesh around them. And the parasites and Candida use biofilms, as I said, to shield themselves from the body's defense mechanisms and from, in some cases, treatments. And so by hiding within these biofilms, they can evade detection. And this is what can be quite tricky when trying to actually diagnose or find them specifically to, get the proper treatment, is that, that's like their innate intelligence. That's their mechanism of survival, right? If they can survive, we all want to survive. That's how they design themselves to survive. So they can thrive and multiply. But that, of course, is detrimental to us and it can lead to chronic health issues. And so it does make, doing treatments a little bit trickier and a little bit harder to get at. And sometimes you have to be a bit more persistent. But in my opinion, this is where the terrain, modulating the terrain and getting the terrain into the healthiest it can. I mean, you just think that this is a perfect, season. We're out planting in the garden and we want the best soil for our plants to grow and thrive and give us, the best fruit or the best flowers or whatever. Well, our body is the soil and we want to nurture it so that it can be the most resistant to all these things and create the best immune system and everything else that comes from that. So then this biofilm itself is a key contributor to inflammation. So that in and of itself can lead to digestive problems, fatigue, joint pain, etc. So typical biofilm disruptors, and you kind of heard about some of these in the last talk. We have proteolytic enzymes such as bromelain, papain, serrapeptase, which is also a mucolytic enzyme. So it's very good for Candida because a lot of Candida will invade the mucosa. And the fibrolytic enzymes such as nattokinase and lumbrokinase are great at breaking up fibrin and these protein mesh. And lumbrokinase, just so you know, it is not NPN regulated in Canada, but I know it can be found from other sources. So when we're talking about herbs and supplements, obviously there can be some crossover, but I tried to delineate between parasites and Candida. But there can be some crossover, especially with essential oils and things like that. But black walnut, wormwood, and I put clove in the food category, but it can also be an herb in here. though that's a key combination that I've used for my whole 28 years for parasites. And there's another combination that has cassia bark, male fern, and also capsicum, or the, oh, there's the cloves that was in it. Should be in a different line. Um, in that have a little bit different formulation, whether it's flukes or tapeworms or whether it's roundworms. So again, depending on who you would see to help you with this, and depending on the type of parasitic infection that you think you might have or someone might have, they would want to maybe tailor their herbal combination that would address more the roundworms, the pinworms, or the flukes and tapeworms. Turmeric is also very good, and that has even some biofilm disruptor capabilities. Thyme, sage, pine needles, essential oils are really great. Some of them are you can take orally, just have to be very careful with those. And you would use them obviously to rub on your feet. Putting them on your feet is an excellent way. We know that through reflexology and the whole homuncular system, that a lot of things can be absorbed extremely well through the feet. In the Candida category, olive leaf, that's like my number one fantastic herb. And in the supplement form of these, I like the whole herb, and I like to make sure that it's got all the components. You know, there's a lot to be said for the active parts, but using as nature intended, which all the cofactors are in the whole herb, that would certainly apply to something like golden seal or Oregon grape, which the active ingredient to that is berberine, but I personally like to use the whole herb in the whole herb form. Monolaurin is a good biofilm disruptor as well, but it's also good in its more complex form, the C3 form of caprylic acid, or in some cases, just consuming coconut oil can give you the properties to be able to get at the candida. Chlorella is a binder and really works well for, and would work well for parasitic infections as well. It's like a good cleanup herb and to bind things and pull it out. Bentonite clay, as you're cleansing and detoxing with these organisms, you want to have things that are doing the cleanup, that are doing the binding, that are, you know, absorbing up all the waste material. So bentonite is excellent for that. In some cases, some people love zeolite and charcoal. I don't have a lot of experience personally with zeolite, but I've heard good things about it. I tend to go more with bentonite personally. And obviously, that scrubbing and cleaning that you want for the bowel, which is psyllium powder, which is the husk and seed, ground flax seed, you know, any other ground nuts and seeds. And for the mucosa, for you know, sinus irritation, when candida seems to settle up in the sinuses and the throat, golden seal spray is really great as a binder and a biofilm. And then, of course, you want some supplements and herbs that would help for just your immune system. So extra vitamin C, vitamin E, and zinc, lots of good food sources for that. Acerola cherry is excellent for vitamin C. Wheat germ is great for vitamin E. Pumpkin seeds are great for zinc. Plant sterols and sterolins for the immune system. And then these other binders, fulvic acid, humic acid, those are soil composition things. You can find those in a pre and probiotic mix, which are excellent. And pectin in fruits. So green apples, where you would find a high amount of pectin. Homeopathics. We've got lots of combinations from different companies. So I've just mentioned the companies here that you can take because you need to work with a practitioner to get the right combinations. But homeopathics are really powerful. They work on a vibratory state. So they help in part of that frequency level to actually neutralize these organisms on a energetic level and to help bring them back into their more symbiotic form. So Biomed is in Burnaby, BC, Dr. Reckweg and Pasco from Europe. These are three good companies that you can check out some of their combination forms or talk to your practitioner about using those combination forms. And single homeopathics, Cinna is one that's great for children. Tecreum, Felix, which is more for tapeworms and flukes. And then you can get specific ones that are hookworm and threadworm. Different companies will do homeopathics that can be specifically succussed or, blended for those particular organisms. And for Candida, same kind of thing. And the singles, singles are more tricky because they go with the constitution of the person. So sulfur, borax, mercurus, arsenicum, saccharum, they go along with your symptoms, but also connect with the constitution and the personality of the person. And that's what's quite interesting about homeopathics is, again, they're looking at a very holistic approach. Tissue salts are a type of homeopathic that are a dilution that actually still has some of the element in it. And they are very good in terms of altering the terrain and modifying the terrain back into healthy states. So tissue salts are really important for that. So when you start a treatment plan, again, we're going to work with the terrain first, because the healthier we get the terrain, the more alkaline we get the terrain, the less die-off and side effects that you would have when you start actually using herbs that are going to do a deeper job. But something called Herxheimer reactions, which are die-off type of reactions, they can be managed and mitigated also by a graduated approach. So specifically, I find that with our vax-injured clients, you already have a compromised system. So these kinds of things do have to be done under supervision, and they do have to be done very mindfully and very gradually. You do want to make sure that your system is strong before you start to, kind of do some attacking, so to speak. But other things that you'll see is change in bowel function. Well, obviously, change in bowel function to maybe a bit of diarrhea or something is very good, because you want things to be exiting the body, and you want to keep the bowels moving well. You might notice different odors or tastes. Again, with Candida in particular, because of the mercury connection, you might taste a metallic taste that would go along with, clearing out the Candida. Flu-like symptoms, headaches, nausea, blocked sinuses. These are all things that can happen, and they should pass along fairly easily. If they extend for a longer period of time, you're going at things too aggressively. You need to back off and take it a little bit slower until things re-regulate, and then you can ramp up. But one of the things that you do want to do is you do want to push the body a little bit so that it gets into a mode where it's actually doing something. If it's that fine balance, because if you're not doing enough, then you're probably not going to clear it, completely or as effectively. So if the reaction, like I said, is too strong, you can also do some things like an Epsom salts bath. You can check your hydration and make sure you're properly hydrated. You can do an infrared sauna. You can up your anti-inflammatory type of support like quercetin or vitamin C with bioflavonoids, and appreciate what your body is doing anytime you're doing any detoxing. It's doing a lot of work, and you need to rest. You need to respect that you need extra rest. So prevention, again, similar approaches for both of these organisms. We need good beneficial bacteria. We need good digestive function and a robust immune system, bar none. We need to eat whole foods and a pesticide-free diet. Okay, so you can buy food from your local producer. If you know that it's pesticide free and maybe not necessarily organic, well, that's an excellent choice. As long as you know where your food is coming from, that's really important. And obviously reducing your exposure to toxins in any way, shape, or form. So, again, like I mentioned, checking things in your environment. Where can you make some improvements? Managing your stress. Stress is different things to different people. What are my stressors? Make a list of them. Find out what stresses me out. What can I do about it? Or are these things that I can't do something about and I need to just let go? That's a big piece of it. As I mentioned already before, keep your digestive system in top working order. Stomach acid is one of the primary barriers, especially for anything ingested by mouth. It can act to kill any kind of invader. It should act almost instantaneously. The problem is through the, kind of sad diet that we have these days, stomach function is just not where it should be. So apple cider vinegar, again, hydrochloric acid, betaine, bitters. I learned about when we were in Europe something called Fernet Branca. It is a Italian um, digestive, and it has 27 bitter herbs in it. Now, it is alcohol based, but you can heat it up and burn off the alcohol. It's a fantastic blend. And I bet a lot of you who maybe drink has 56 different herbs. And it was created in 1935 in Germany. The Fernet Branca has been around a little longer, 1845 from Italy. And 56 herbs that are absolutely fantastic. We met a couple who were told when they were young and hanging out in student residences in Europe, in university, and they were told by someone else a little older and wiser, just drink a little tiny thimbleful of Fernet Branca every morning, and they never got sick with anything. It worked really well. So again, if you can burn off the alcohol, that's a fantastic. You can easily get bitters in lots of different combinations that aren't alcohol. Pre and probiotics, fermented foods, although they're not a really good option with Candida. And again, as I said, keeping the bowels moving, constipation, stasis adds to breeding ground for pathogens. I don't know how many clients I've coached over the years who think that having one bowel movement every few days or once a week is normal. Not normal. They've been told by their medical doctors, oh, well, it's normal for you. No, it's not. It's not normal in any circumstances. So make sure that you're, eating enough fiber, adding in some magnesium, making sure you're hydrated. Your stomach function has a lot to do with that digestive cascade to make sure that your bowels are moving well, right? It all works as a system. Lifestyle, especially for the Candida related stuff, removing amalgam fillings and doing it properly and safely. Root canals can be another breeding ground for Candida infection. We could do a whole thing just on teeth. Cleaning up your personal care and cleaning products, as I said. Reading labels, finding out where your toxic chemicals are coming from. Vinegar and baking soda or washing soda go a long, long way for cleaning products. A parasite cleanse for everyone in the household twice a year. That's a great thing to do. And like I said, I reviewed all this information, went, I'm going to do a parasite cleanse because I haven't done one for a while. So it just makes sense. Spring and fall are good times to do one. And one thing I forgot to mention about treatment for parasites is they're more active over the full moon. So they need to happen over a full moon time period. You need to start 5 days before and go at least 2 weeks after. Then you can take a break and restart and do it as many months as you need to do it in order to clear the infection. For parasites, we can be easily exposed when we're outside walking barefoot or digging in the garden. That's a very simple one. Just, make sure you scrub your hands when you come in, use a nail brush or checking your feet. It's just like when you come back from a wood walk in the woods is to be checking for ticks and things like that. Just doing a check on your body or within a day or two if you've got a rash. Using one of those essential oils I mentioned topically and scrubbing and making sure that you clear it off. And a big one for parasites. I know everybody loves their pets, but pets are great carriers of of parasites. And, they can kiss your hands, maybe your cheek, and they can sleep in their own bed, not in your bed. And that's just a great way, and my son now has a dog and I talk to him about this all the time, but the dog still sleeps with him in the bed. But we had a dog for 12 years and that dog never slept in a bed and it never kissed a face on the mouth. It just didn't happen because I knew too much. With regards to Candida, keeping the terrain healthy keeps everything in check. Avoiding antibiotics, chlorinated water, and other different exposures that are going to disrupt the good bacteria in your gut. And also, keeping sugar in check, because Candida, sugar is their main nutritional source. They love sugar. So just keeping that in check. And once you've had exposure to either of these organisms or infections, you actually can be susceptible to reinfection if you don't keep your terrain in good shape. Personally, I've had that in my history. And so if I get a little bit too lax with my sugar intake, I can definitely feel it with different things that start to, itchy ears or different things that start to bother me. So those are the kinds of things that you can pay attention to, that your body's talking to you